Hello, Facebook Live, 7 o'clock, Tuesday night, hoping the audio is working. Oops, hoping everyone is well this evening. So I want to talk about a few things today. If the audio isn't working, please put a comment. Well, actually, that's a crazy thing to say, isn't it? Actually, if it is working, can you put a comment? Because if it isn't working, you won't be able to put a comment. I'm just going to assume it's working. I'm going to go ahead with it, and I'm just hoping that if it's not working, hey Gemma, is the audio working? Yeah, it's working. Good. It's just I'm on the little mic rather than the white one in my ear. So I'm going to talk about a few things today. First thing I wanted to talk about is something I've added to it. Actually, this wasn't a question, but I want to talk about complications for a couple of reasons. One is that I have seen quite a few people of late who have not wanted whenever I talk about complications to patients when they're having surgery, I put the first thing is I put scar, and I always say that's not a risk, that's a definite. So it's not a complication, it's definite. There are potential for complications with any surgery, but scarring is pretty much a given for everything that I do. And I've seen a few people who don't want the scarring, and they're very keen not to have the scarring. And I show photos of scarring, and there's often a tendency for people to think, oh, but it's not going to be that bad, is it? And to be honest with you, I try and be realistic with people, and the best way to avoid complications and to avoid scarring is to not have surgery. And if you're going to have surgery, you've got to take on the potential for complications. And it's absolutely fine not to have surgery. I had a long chat with someone on Friday who didn't want scars, and I showed them photos of some of my cases, and to be honest with you, scarring often fades pretty well, but I can't 100% guarantee it's going to fade that well in you. I don't know how the scarring is going to go in every patient. I can just say what it often does and usually does, and it's up to you as a patient to balance the risks against the complications and the risk for complications. And it might be that the balance is too far on the complication side, in which case don't have surgery. I feel that our role here is not to encourage you to have surgery. It's just to tell you about what's possible, and it's not for everybody. And complications are possible. But the other thing that I wanted to say about complications is I think that it doesn't matter who you are and how good you are as a surgeon, you're always going to get complications. And I think that one of the big things that separates the sort of quality surgeons from the people who don't have a good reputation is how they manage the complications. Now, there is a situation, as a fully trained plastic surgeon, as a member of BARPS, I have to, we all have to give our figures to BARPS every year to show that our complication rate is within norms. So we've got to make sure that our complication rate isn't outside the normal, and we are sort of assessed against our peers on that. But I think, you might think these cowboy people, maybe they get higher complication rates. I don't know, because they don't have anywhere that they have to submit the complications if they're not a member of BARPS or any other association like that. But the main thing, or the other thing, is how you manage the complication. Because I think, you speak to any surgeon, we've all got complications. There's always potential for problems. You try and make it down to the minimum. And one of the good things about cosmetic surgery is very low risk of complications. But I think this thing that separates the quality surgeon from the others is how you manage your complications and how you deal with the complications. And certainly in my practice, I always feel that my complications are my most important patients at the time, because I think people often feel bad when they have well, obviously they feel bad, but they feel a bit sort of, maybe guilty is not the right word, but they feel, oh God, I don't want to sort of phone again, or don't want to contact them again. But for me, I'm like, we'll be phoning you. I think we need to make sure that we look after people and we get them through the complications, because that's difficult. It's often, I've just answered a question on Real Self just now about a patient who had a complication, and I think it's important, and she's putting it on Real Self. I feel like saying she should be going to a surgeon, and she shouldn't really be needing to go to Real Self. She should be being looked after by a surgeon and given advice by a surgeon, because I think you need to feel like you're being looked after, and you need to get through it with your surgeon. And it's difficult for the surgeon as well. It's probably hard. I guess people with the complication maybe don't have that much sympathy because they're going through the complication themselves. But it is difficult, and it's a tough part of the job, especially with cosmetic surgery. Yeah, I think I wanted to talk about that just because I got getting these people coming and not wanting scars and things. And I think maybe maybe many years ago when I started out, there'd be a tendency to say to people, oh yeah, but the scar won't be that bad. But I don't do that anymore. I just say, yeah, that's the scar, and that's an average scar, and you're probably going to get an average scar. I hope you're going to get a better than average scar, and I hope you're not going to get a worse than average scar. But the law of averages says you're going to get an average scar. So, I try and show people average, realistic results. And if that's not suitable, or if you're then don't have the surgery, because it's often the case that people don't need to have the surgery. It's a question of wanting to have the surgery to make things better. And I have to say, it usually does make things better. But yeah, that's my view on complications and management thereof. So I'll put that one in myself. These are the real questions now. Sleeping on your side. I think it's actually sleeping on your side, bathing and exercise. I think it's all one. Sleeping on your side, bathing and exercising after breast implants. So I've just had this discussion with someone today or yesterday actually about this. When can I sleep on my side? I never tell people they can't sleep on their side after they've had breast implants. But a lot of people ask me when they can sleep on their side, when they don't have to sleep sitting up anymore. So I don't know who's telling them, and I don't know where they're getting it from, but it's not from me. So my view is that wear a supportive bra, but you can sleep any way where you want. Now, obviously, it's going to be uncomfortable to sleep on your front. Even if I said you could sleep on your front, you wouldn't, because it'd be uncomfortable. So don't sleep on your front. But sometimes it's uncomfortable sleeping on your side. So in which case, sleep on your back. Sometimes people find it they can't sleep on their back. And certainly sleeping sitting up. I mean, there is a reason for sleeping sitting up. It's because it helps with the swelling. So I know if people are telling you to sleep on your sitting up, I can understand why they're doing that. But I don't tell people to do that, so I don't know where that's coming from. But I think, so I don't make a big deal of it. For me, it's more important that you sleep, because if you can't sleep, it's horrible. So if you can't sleep sitting up, just sleep anyway. Sleep on your side. But you might find it uncomfortable to sleep on your side, in which case sleep on your back. Doesn't really need me to tell you that. That's just do what you feel comfortable doing. Is my view on that one with breast implants. But that's just my view. I guess if other people are watching this who've got other surgeons, maybe there are other surgeons who tell you to sleep sitting up. So you better do what they say. Do what your surgeon says. I wish people would do their surgery. Well, because people say, when can I sleep on their back? And I haven't told them not to. When I can sleep on I haven't told them not that they can't. So obviously they're not. But anyway. Yeah, get the point. Sleep on your side, but bathing and exercising after breast implants. So breast implants, bathing is normally, bathing is breast implants. You have a little water. Again, this is me. I don't know what other people do, but this is me. So for me, I put a waterproof dressing on the wound, and that is waterproof. It's splash waterproof. It's not totally waterproof, so you just go with your back to the shower, and always say don't get in the bath because it will just float off, so don't get the pad wet. But again, so I let people shower day one, straight away, and exercising after breast, day naught, even day of if you want. Exercising after breast, obviously take your bra off to shower. So you wear the bra day and night for a month, but that doesn't mean you take the bra off to shower. After a week, we take that dressing off, then you can bath, shower, do whatever you want, because you don't have any dressing on after a week. Exercising after breast implants, most things is exercising usually 2 weeks, because it swells a bit. You don't want to do it when your dressing's on, you're a bit hot and sweaty, so you don't want to do dressings on for a week. Second week, you're probably not going to feel like doing a great deal. Gentle exercise after 2 weeks, starting with the lower body, exercise bike, the stepper, things like that, but not too crazy with your arms. And then 4 to 6 weeks for the arm stuff, weights and things like that. And then start gently. All of this, start gently and build up. Putting lotion onto wounds after surgery. Now, I think I know what that is. And if I know that I was asked that question, wasn't I, last week? I think, was it over the weekend, or I got an email that question and I haven't answered it. So I feel bad about that. That has made me feel bad about that. So I will, as soon as I finish this, properly answer that to the person who's asked that question, because I think that is a question about someone who's had a shave excision of a lesion, and they're asking when they can put wound lotion on the wound. I think that is. If it's not that, then I'm off base. But so if it is that, when you have a shave excision of a lesion, I put a little Steri-strips, if you know what they are. They're like paper tapes with a bit of like Kelterstat or cotton wool thing on it, and then that falls off after a couple of days. And then as soon as that falls off, you have a scab, and then we give you a little tube of antibiotic cream to put on 2 or 3 times a day for a week. So if that's the question, that's it. So as soon as this dressing falls off, you put the cream on 2 or 3 times a day for a week. If it's not that, because it might just be putting lotion onto wounds after surgery, thinking about it, it might not be that. So if it's not that, if it's just generally putting stuff on wounds, I don't, apart from that antibiotic cream onto shave excisions, I don't normally advise putting any lotion onto any wounds. Now, most of my patients, apart from a shave excision, will have closed wounds. So they don't have open wounds unless the wound opens. But the idea is that you close the wounds, you have a dressing, you take the dressing off after a week, and the wound is healed and closed. So you don't need any dressing, you don't need any ointments, you don't need any Savlon or creams or ointments or anything like that on the scar, on the wound. You just have fresh air on it. I do suggest that you start massaging, but I normally wait at least a month. I normally see at that 6-week mark after surgery, and then I suggest the massaging at that stage. So if that question might be relating to that massaging and putting stuff on the wounds. So if it's a normal scar, like a tummy tuck or a breast surgery or something like that, then nothing on the wounds for a month, and then start massaging it with cream. There's no particular cream that you need to use. Bio oil, a lot of people say, or aloe vera, vitamin E, all sorts of people say all sorts of things. For me, it's more the moisturizer on the wound is the main thing. And then I'm coming up just for warning, a bit like last orders. I should have a bell. This is the last question now. So I've got a thing for comments. So if you have any questions and you want to ask, please ask me, because I'm coming to the end now. I'll string out pseudogynaecomastia as much as I can, but I've got to tell you, I've not got a huge amount to say on pseudogynaecomastia, but I will do my best. What is pseudogynaecomastia? This is a patient who has been in touch to say they have been told they've got pseudogynaecomastia, and I can't remember what else they said, but maybe they probably said, how, can I help or something? This is a situation where people are giving names to stuff, and I don't know how helpful it is, to be honest. And this is a problem with the world we're in, with the internet and all that. It's a bit like I had another question on, was it on Reels or somewhere, about tuberous breast deformity. Someone says, have I got a tuberous breast deformity? To be honest with you, it doesn't matter whether you've got tuberous breast deformity. It doesn't matter what pseudogynaecomastia is. It doesn't even matter what gynecomastia is. What matters is what your problem is. Have you got a problem? And then can something be done about it? So, the thing about giving labels like tuberous breast deformity, if you're happy with your size, the shape of your breasts, who cares? Whether you got tuberous breast or not tuberous breast, doesn't matter. That's it. If you're not happy with them, then look if something can be done. Again, doesn't matter what it's called. Pseudogynaecomastia is how helpful it is, I don't know. So gynecomastia, basically, men have got breasts just like women have got breasts. Gynecomastia is excess breast tissue in a male. And the breast is made up of 2 components. It's made up of glandular tissue, which is dense, hard tissue behind the nipple, and fatty tissue. And the treatment is different compared to whether you're using the fatty tissue or the glandular tissue, or a combination of the 2. Pseudogynaecomastia is when it's mainly fatty tissue rather than glandular tissue. And it is more than, the first thing to say is if you're overweight, so if it's fatty tissue because you're overweight, the first thing to do is to lose weight, because if you lose weight, it can get better. So if it's pseudogynaecomastia due to, and it's hard to tell whether it's fatty or glandular. I don't know if you've had a scan to tell you that, or if it's just clinically, you can actually feel that dense tissue behind the nipple. If there isn't a great deal of that dense tissue, and it's mainly fatty tissue, then weight loss is the first thing. But some people do have gynecomastia when they are not overweight, and these are the people who are better candidates for surgery. It's uncommon to have pseudogynecomastia if you're not overweight, It's uncommon to have pure fatty gynecomastia if you're not overweight. Uncommon but not unheard of, so it's possible. So if you're not overweight, or if you're comfortable and stable with your weight, and you've still got gynecomastia, and if it is true pseudogynaecomastia, so purely fatty, the treatment is then liposuction to get rid of that fatty tissue. If there is any glandular tissue, then you might need that little cut underneath the areola to take that little bit of glandular tissue out, because that can be annoying sometimes when you don't remove it. But the treatment of pseudogynaecomastia is liposuction, because it is fatty tissue, assuming your weight is right first. If it's not right, get your weight first. Oh, Gemma's asked to look at that while I've looked up and looked down. It's my boobie's first birthday next week. Yay. Been the happiest year of my life. All right, that's right. Okay. Happiest year of your life. God, I'll tell you what, we should advertise that, shouldn't we? Make this year the happiest year of your life. Have some breast implants. That's an advertising campaign right there. And that's some pretty impressive emojis going on there, Gemma. I'm very happy about those. It's a champagne bottle, and I don't know what the other thing is. Anyway, that's great. Thanks, Gemma. Thanks for that. It's a comment, and I can like this because I'm on my computer, so I'm going to like that right there. So, and there's a thank you like that. So that's kind, and that's very, very nice to hear. And happy birthday next week, Gemma, for you and your new self. So I'm very pleased that you have had a happy year. That's lovely to hear. Right. So I think I'm all questioned out on that. So I'm going to tell you now. Hear me now. Anyone who's watching this, we've got the app is a little bit in development still. It's there on Google Play, but the iStore, it's a bit not the iStore. What's it called? The iTunes place, iTunes, is it, or Apple Store or App Store place? It's still in development on that one, so we haven't got that through yet. But we have got the app coming. But we've got a podcast of these Facebook Lives, and also they're on YouTube channel. So please subscribe to the YouTube channel and look at the podcast. The podcast is on iTunes. The podcast is solid. That's on iTunes. It's the app that's in development, and the app will have the podcast and the YouTube and all that on it. So there you go. There's please look at that. And that's me for the day, and I'm going to go away, and I am going to beseech you to ask any questions, please, and I will answer them next week at 7 o'clock on Facebook at 7 o'clock at Stayano Clinic Facebook page. So I'm going to check myself out. Thank you very much for joining me, and I am out of here. Bye.